It was a new virus. It spread to humans, and it could spread fast. I assumed the idea of doing nothing to get herd immunity also crossed minds, because that will minimize the economic impact and social disruption. But what about the toll on lives? How many people have to die to have social immunity? And China has a large population, needed to do something, big and quick. We went back to the basics, testing, isolation, and contact tracing. But that proved to be challenging. If you have enough testing kits and trace contacts thoroughly, you don't need to isolate everybody. That is what Singapore and South Korea did. But in the beginning of the outbreak, Wuhan did not have enough testing kits and could not trace everybody. So the Chinese did the extreme. Wuhan was locked down. People stayed at home. The lives of millions were disrupted, and the economy came to a halt. A month later, the epidemic was under control. Blinded by stereotypes like how we can trust information from a communist country, you are not only doing injustice to the painful efforts of the Chinese, you are denying yourself a chance to gain insights into a common enemy that respects no national borders and political inclinations. Let us not be provincial here. Some of the ideas and practices might not apply elsewhere, but it won't hurt to listen. Isolation means isolation. It needs compliance from the people. China underwent a period in which the government moved infected patients and even their close contacts from their homes and put them in strict quarantine. That is extreme. But that also dramatically cut down infections. People think of the Chinese as disciplined, but what I saw in Wuhan was beyond normal discipline. Nobody stayed indoors because their apartments were blocked by metal bars. They stayed at home because they commit to each other.
I must give the British people a very simple instruction. You must stay at home to slow the spread of the disease.
Never in peacetime have we seen anything like it. This is the story of Britain's first 2 weeks living in lockdown.
One of the key aspects of Chinese policy was lockdown, and you have a well-organized response to earthquakes and all sorts of national disasters. And when the epidemic came along, the people who organized responses to national disasters were already well organized. We will play our role with China in the global response to this virus. It is a global problem. It's not a national problem. And China is leading the global response, providing a lot of equipment and a lot of help to countries around the world. But for us, the Italians, the Spanish, we're not as well prepared as China in dealing with national disasters. And we're learning very fast.
Is South Africa's slow rate of new infections an indication that the national state of disaster measures are impactful, or is it more complicated? The country currently has 13 deaths and 1,749 infections, which is lower than the 6,000 cases that were expected. As part of the measures to flatten the curve of new infections, the country has also rolled out a mass screening and testing program. Professor Shabir Madhi, who is a vaccinologist at the University of Witwatersrand, now joins us on the line. Good evening, Professor, and welcome to The Full View. First of all, starting off with the introduction to our interview, the question is this an indication that the measures that have been put in place are actually yielding the results that government had hoped for?
So good evening to you. So the short answer is that it's really difficult to tell exactly what is happening with the circulation of the virus and how many people are infected in South Africa. What has happened since the start of the lockdown is that the number of individuals that have come forward for testing has actually decreased rather than increased. So there's fewer people that are coming forward for testing, and consequently it's very difficult to understand whether the sort of slower rate in terms of the day-to-day increase in number of cases is because of fewer people being tested rather than because of the circulation of the virus having been sort of dampened. But with the lockdown itself, what we do expect is that there would be dampening of the circulation of the virus in the community. So the lockdown will have some effect on that, but the problem is that once the lockdown is lifted, unless we've been successful in identifying the infectious cases and isolating them during the period of the lockdown and quarantining the immediate contacts, we risk a major rebound in terms of the number of cases.
Today we came to unveil a number of mobile laboratory test vans. The NHLS has procured 60 mobile vans in addition to the 7 that were currently being used, and therefore it brings us now to 67 mobile testing units in the vehicles which are equipped as laboratories. We should indicate that 44,202 people have been tested, largely in the private laboratories. This, for us, is way too few for the size of population and the inequality, poverty, and underlying burden of diseases and immune suppression that we have. So even though this number seems high, I'm saying it's still far, way too low for the kind of challenges that South Africa faces.
"81 miles from China, Taiwan only has 282 confirmed cases. What did Taiwan do right?"
Taiwan, South Korea are perfect examples of doing testing immediately.
The best healthcare system in the world in Lombardy is now collapsing. Will the U.S. become a second Italy or worse?
To me, you have to crash. You have to shatter the curve.
Can lives and the economy be saved at the same time? What about one place that most successfully contained the outbreak? What did Taiwan do to keep the CCP virus in check? In this episode of Zooming In, we look at facts and numbers, and we discuss these questions with some of the finest minds in the country. This is the city of New York, the cultural, financial, and media capital of the world, now as quiet as a remote rural town. As of April 1st, there have been at least 83,712 confirmed cases of the coronavirus or CCP virus discovered in the state of New York. Taiwan has kept the CCP virus in check. What did Taiwan do right? As of March 28th, Taiwan, an island 81 miles off the coast of China, has reported only 282 confirmed cases and 2 deaths. Life in Taiwan remains essentially intact with only large events being cancelled. Business, restaurants, and schools have stayed open. Experts say that Taiwan's results are largely due to its early response, at a time when the rest of the world seemed to be looking the other way. On December 31st, when Chinese officials notified the WHO of a mysterious pneumonia emerging in Wuhan, the Taiwan CDC began monitoring passengers arriving from Wuhan on the same day. On January 5th, anyone who traveled to Wuhan in the previous 14 days were screened. On January 26th, Taiwan became the first country to ban flights to and from Wuhan. It eventually banned all Chinese visitors on February 6th. Since identifying its first patient in January 21st, the government has implemented 124 safety protocols. Among them is a big data tracking mechanism. All people screened or quarantined for CCP virus in Taiwan are monitored by the government through a mobile phone tracking system. If these people leave home, their phones will send a message to the local police department and the disease control center. They will also receive an alert on their phone that tells them to go back home. South Korea, Singapore, and Hong Kong also tested widely for the virus and quarantined suspected cases. South Korea's curve has recently flattened. Singapore and Hong Kong have not suffered a significant outbreak.
Taiwan, South Korea are perfect examples of doing testing immediately, doing social distancing, right, immediately. And they, through their action of the government, through local official, and basically the people, who can govern themselves showed you that you can put this you can get this virus and back you. Now I hope it continues on in Taiwan. They continue to be very vigilant, but also using the malaria drug. So I think there in Taiwan you saw action that had an impact, and in Italy you saw people trying to wish it away, and it didn't work.
By installing the early travel ban, performing early testing, and using a big data tracking system, Taiwan has been able to locate where the virus is and therefore target it precisely. Can the rest of the world borrow Taiwan's experience? It might be hard for countries like the US to use big data tracking since it brings up the question of individual rights that we hold dear. Also, the United States has long passed the time of early prevention. Taiwan started screening Wuhan travelers on December 31st. We are close to 4 months past that. So what can we learn from Taiwan's success then? I think what we can learn from Italy's failure and Taiwan's success are essentially the same. Either you get control early or it definitely gets out of control later. Following that rationale, how has the US been